Good evening. I'm Marisol. I'll be your patient care tech today. Today I will be doing an abdominal assessment. So I'm gonna go ahead and start by washing my hands up. And then I'm also gonna mess with the buttons on your bed so I can go ahead and raise you to a comfortable position so I won't be bending over. Is that okay with you?
Yes.
All right. You're okay like you are. You're fine. And may I actually see your armband? May you tell me your name and date of birth, please?
Andrea, April 22nd, 1999.
Okay, thank you. Okay, so first I'm just gonna have a lot of questions to ask you before I start this assessment and start inspecting and listening to your bowels and your abdominal area. So when was the last time that you had a bowel movement?
Yesterday.
Okay, no issues or discomfort, okay? Do you have any pain in your belly or any pain as you're having a bowel movement, anything like that? No. Okay. What about with urinating? Do you feel like you go to the restroom, like urinate too frequently or too little? Any pain while urinating? Okay. Do you ever feel like your pee has like a very foul odor? No? Okay. So, okay, let me first, I'm just gonna do a quick inspection as you're just laying there. And then I'm gonna actually have you lay a little bit flatter. Do you think you can scoot down a little bit in the bed? There you go. That's perfect. I'm gonna go ahead and clean my stethoscope. So, everything looks good on inspection. Everything looks contours flat, symmetrical. Now I'm gonna have you kind of tuck your chin to your chest. Okay, so that's just gonna help tighten your muscles. There's no obvious separation of your muscles or anything like that, and everything looks intact. No obvious big movements around your abdominal area. So everything looks good. Okay, and I'm gonna listen to all 4 quadrants with my stethoscope with the diaphragm. Okay, color looks good. No scars. Your belly button looks fine. Okay, so first I'm gonna start off by listening to your left lower quadrant, then right upper quadrant, left upper quadrant, and then left lower quadrant. So right lower. I'm gonna kind of get a little bit down. And then before I begin, you said no pain or discomfort around this area. Nothing feels tender?
No.
Okay. Okay. Bell sounds are within 5 to 10 seconds, which is pretty normal. Okay. All right. So your bowel sounds were occurring 5 to 15 seconds. If it was longer than that, then 15 seconds, then it would mean like you have hypoactive bowel sounds, so your bowel sounds would not be moving as often as they should be. And if they were constant, then they would be hyperactive. Sometimes that is a little bit normal, especially if you have like a fast digestive system or are having a bit of diarrhea or something that day. All right, now I'm gonna kind of just palpate or kind of help you. Yeah, you can go ahead and sit up. Help you visualize like where your liver, spleen, stomach, and left kidney are. So your liver is usually around, I'm gonna go ahead and take a seat next to you. It's around your right upper quadrant. So it's kind of under here. Your stomach is usually kind of in the middle, but more towards your left side. So your stomach is usually like around this area. Okay. Your spleen is usually on your left upper quadrant, so kind of almost the opposite of where your liver's at. And then your kidneys are usually kind of more towards the back. That's kind of where you feel them the most. So it's going to be like all the way over here. Kind of by where the last ribs are. Okay. And then I'm gonna have you now kind of just sit up for me. And then I'm gonna go ahead and kind of do a few little taps, just warning you so you won't get scared. I'm gonna place my palm all on your back and then kind of just hit my hand, which is gonna hit you. That's just gonna, if it hurts when I do that, then that's not a good sign. It's not supposed to cause you any pain. What we're looking at that is to see, or if that signifies that you have a kidney infection. So it's usually around this area, kind of where you're right there. All right, I'm gonna go ahead and hit. All right, now I'm gonna do the other side. All right, no pain when I was doing that? No. Okay, any questions, concerns at the moment? All right, well, I'm gonna go ahead and put your bed all the way down. Lowest position, help you cover up, give you your call light, and if you need anything, just give us a call, okay? Thank you so much. I'm gonna go ahead and wash my hands again before I leave, since I just went ahead and inspected, did the palpation and everything, and thank you.